People ask me, what is periodontal disease? Basically, periodontal disease is gum disease. Gum disease consists of gums getting inflamed and irritated, which causes over time the bone underneath the gums to get irritated and start losing bone and gum around the teeth. Basically, the way it is that your teeth is sitting, is basically suspended in a ligament inside your jawbone, and the gum is covering all that area. Once the gums start getting diseased and problematic, they start getting inflamed, which causes bleeding in your mouth. When you, for example, brush your teeth, you feel and you see a little bit of blood on your toothbrush or when you spit. And then over time, that progresses to losing bone around the teeth. And after a while, as the bone deteriorates, and by that I mean it literally melts away around the teeth start getting loose. And once that starts happening, then it only goes south from there, because then the teeth get more and more sensitive. They get more and more loose because you're obviously chewing your food and using them and putting pressure on them. And once that bone starts to deteriorate and melt away around the teeth, it only goes away. It never comes back. So basically, it is best to try to avoid any of those problems by having cleanings done at least every 6 months, so we can diagnose if there is any issues that need to be fixed. Because once you lose that bone and gum, it is gone. There is no coming back. It is not like if I go in there and get everything cleaned and fixed, all those gum and bone is going to come back up to where things used to be 10 years ago. It never gets that way. So basically, you want to prevent any further gum disease and bone loss to avoid any other issues, which is basically anywhere from just having teeth that look a little long because the gum isn't covering the root tissue, to actually losing one tooth or multiple teeth, because as it affects one tooth, it affects the tooth next to it. There is no partition or anything between your teeth. They are sitting literally millimeters away from each other. So when there's a problem with one, it doesn't take long before there's a problem with the one next to it. So it's a cascading issue, and you want to prevent any of that from happening. Much easier and much cheaper to fix it when it's a small issue than let it go and causing it to be, like I said, a big problem that could even affect most of your mouth.